Niacor, also known as niacin or vitamin B3, is used to help lower bad cholesterol and fats, LDL, triglycerides, and raise good cholesterol, HDL, in the blood. It is typically used when non-drug treatments have not been fully successful at lowering cholesterol. Niacin can also be used with or without other medications to help prevent strokes and heart attacks. It may also reduce the risk of pancreas problems, pancreatitis, in people at risk. In addition to a proper diet, lifestyle changes such as exercising, losing weight, and quitting smoking may help this medication work better. Consult your doctor for the best way to take Niacor and for more details. When taking Niacor, it's important to follow your doctor's instructions. Usually, you'll take this medication 1 to 3 times daily with food. If you take it once daily, take it with your evening meal to reduce side effects. Niacor comes in different formulations, so don't switch between strengths, brands, or forms to avoid severe liver problems. Your doctor will start you at a low dose and gradually increase it based on your medical condition. It's important to follow their instructions carefully, even if you're switching from another niacin product. If you take other drugs to lower your cholesterol, make sure to take niacin at least 4 to 6 hours before or after these medications to prevent any interactions. To minimize side effects like flushing, avoid alcohol, hot beverages, and spicy foods around the time you take niacin. You can also take a plain aspirin or ibuprofen 30 minutes before taking niacin to help prevent flushing. Take this medication at the same time each day and continue to take it even if you feel well, as most people with high cholesterol don't feel sick. It's important not to stop taking niacin unless instructed by your doctor. If you do stop, you may need to return to your original dose and gradually increase it again. And don't forget to continue following your doctor's advice about diet and exercise. When you take Niacor, you may experience flushing of the face and neck, along with warmth, headache, itching, burning, sweating, chills, or tingling within 20 minutes. This flushing may last for a few hours after use, but should improve as your body gets used to the medication. You may also experience dizziness, upset stomach, heartburn, nausea, vomiting, and diarrhea. To reduce the risk of dizziness, get up slowly when rising from a sitting or lying position, especially if you are also taking medication to lower your blood pressure. Remember that your doctor has prescribed this medication because the benefits to you are greater than the risk of side effects. Many people using this medication do not have serious side effects. However, if you experience nausea or vomiting that does not stop, fast or irregular heartbeat, severe headache, unusual joint pain, swelling of legs or arms, vision problems, severe stomach or abdominal pain, black stools, easy bruising or bleeding, unexplained muscle pain, signs of kidney problems, dark urine, vomit that looks like coffee grounds, or yellowing of eyes or skin, you should contact your doctor right away. A serious allergic reaction to this drug is rare, but seek medical help if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. As for the daily dosage and optimal timing, it is important to follow your doctor's instructions, and take Niacor exactly as prescribed. If you have any concerns about when to take this medication, be sure to ask your doctor for guidance. Before taking niacin, make sure to tell your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to discuss this with your healthcare provider. Before using niacin, it's important to let your doctor or pharmacist know about your medical history, especially if you have low blood pressure, alcohol use, bleeding problems, diabetes, gallbladder disease, glaucoma, gout, heart disease, kidney disease, liver disease, mineral imbalances, stomach/intestinal ulcers, or underactive thyroid. Niacin can make you feel dizzy, especially if you consume alcohol or marijuana. It's important to avoid activities that require alertness until you know how this medication affects you. Limit alcohol consumption and talk to your doctor if you use marijuana. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications you are taking, including prescription drugs, non-prescription drugs, and herbal products. Niacin may rarely increase your blood sugar levels, which can worsen diabetes. If you have diabetes, it's important to monitor your blood sugar regularly and share the results with your doctor. If you experience symptoms of high blood sugar, such as increased thirst or urination, be sure to notify your doctor. If you are pregnant, it's important to discuss the risks and benefits of taking niacin with your doctor. Similarly, if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of any potential drug interactions with Niacor, as they may change how your medications work or increase your risk for serious side effects. Keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's also crucial to check all prescription and non-prescription medicine labels carefully, as vitamins/dietary supplements may also contain niacin or niacinamide. Taking these together may increase your risk of side effects, so it's important to ask your doctor or pharmacist for more details. Additionally, Niacor may interfere with certain lab tests, possibly causing false results. Make sure to inform lab personnel and all your doctors that you use this medication. As for the optimal timing to take Niacor, it's best to follow your doctor's recommendations for the daily dosage and timing. If someone has taken too much Niacor and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the United States, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It is important not to share Niacor with others. Your doctor may also order lab tests, such as blood lipids, blood sugar, and liver function tests, while you are taking this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Niacor, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to take niacin exactly as prescribed by your doctor to get the most benefit from it. When it comes to storing Niacor, it's best to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom and always remember to keep it out of reach of children and pets. As for disposal, make sure to properly discard any expired or unneeded Niacor products and consult with your pharmacist or local waste disposal company for the best way to do so. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.